Hello, this is the fifth in a series of videos on the subject of clubfoot and clubfoot correction. In the first few videos we talked about techniques. In this particular video I would like to discuss records, treatment records in particular. The record of treatment in the history of clubfoot treatment is very important. Often, in many clinics, records are not well kept, and the consequence is that in many cases there are too many casts. The literature on Ponseti indicates that an effective outcome can be achieved in 4, 5, perhaps even 6 or 8 casts, a few number of casts. In many clinics, it is not uncommon to see 15, 20, even 30 casts, which is a real hardship to the parents and a real drain on the time that doctors spend on patients. So it is important to achieve a good outcome in as short a time as possible, and records enable doctors and technicians to track their performance. Without records, you have no knowledge of where you've been, and with records, you can tell whether you're making progress or not. So, one of the essential elements in a record is the Pirani score. A Pirani score characterizes the severity of a clubfoot. It is in two components. The forefoot and midfoot is one component. The hindfoot is the second component. The forefoot has a medial crease or a cavus, a curvature of the lateral border, and the exposure of the head of the talus. The hindfoot has a posterior crease, an empty heel, and rigidity of equinus. The numbers that are associated with a Pirani score are quite simple. There is a 0, there is a 0.5, and there is a 1. The definition of a 0 is completely normal. A completely normal foot scores 0. A completely or severely abnormal foot scores 1. Anything in between a 0, which is normal, and a 1, which is severely abnormal, is somewhere in between, and that is a 0.5. And that 0.5 can cover a whole range of variations. What's really important is the difference between a 1, which is severely abnormal, and a 0, which is normal. So, records have scores. But even more importantly, records reflect the number of casts. The literature in Ponseti, which is based on 30 to 50 years of follow-up studies, indicates that a clubfoot, an idiopathic, which is a typical clubfoot, can be corrected in 6 to 8 casts. It is not uncommon, if you go to clinics around the world, to see 10, 15, 20, or even more casts being applied to an idiopathic clubfoot. This is a problem. It is a burden on the families, and it is a burden on the healthcare facilities. If 20 casts are being applied to an idiopathic clubfoot, that means that doctors are working twice as hard and twice as long as they need to. A good record of treatment will tell the supervising doctors when to step in and intervene in the procedure. So records have a value. Records tell you where you've been, and records help you from going too far in the wrong direction. Good record keeping is essential to good outcomes. We'll discuss more on the subject of records and techniques in future videos. Thank you.